But let's go ahead and start talking about the orthopedics campaign, which is going to be the central context of this real-time data concept. One of the first questions that we got from a lot of folks was, well, why did you prioritize orthopedics for a CRM campaign to begin with? And actually, the reason we did, this is my first joke of the day, is because the orthopedic physicians told us to do so. And for those of you who've worked with orthopedic surgeons and physicians, you know they don't lack for clarity nor an opinion. So that was a primary reason. But in all honesty, it had to do with both external and internal factors. Externally, very highly competitive market. We want to own our market share. We've been gaining some market share recently. We wanted to continue that momentum, and we felt like prioritizing orthopedics for this type of new modern marketing would help us move that needle even further. Consumer preferences, we've been tracking, obviously, service line preferences with consumers for years. We saw that we've been gaining ground over the last couple of years, specifically in our local market in orthopedics, and we wanted to continue that trend. We also are dealing with a concept that many of you may be dealing with, is that, at least in our market, orthopedics was not always described in our market research as an AMC-type product. It wasn't cancer, it wasn't kids, it wasn't neuro. It was in that bucket that said, well, we can go other places and get just as good orthopedic care. Why do we need to go to an AMC? So it's something that we said, hey, we need to stick a flag in the ground. We need to keep working and moving orthopedics in terms of both preference needle and volume needle, and so that's the external factors that influences. Internally, product readiness, very well organized service line over the past couple years under a new chair, extremely well organized, and obviously it's a high dollar margin in our market, so we wanted to go after that as well. They've expanded their network geographically in our region. They're gaining some scale, and because of that, they've gained a lot of internal prevalence and power. And we knew that if we could bring this group around, we could probably bring anybody around. And we also wanted to make sure that we had a powerful ally early in the CRM process internally besides us. I knew, and our team knew, we needed some internal champions to be talking about this concept broader than just us. We felt like this orthopedics group was the right group to do it. Orthopedics also needed a new marketing model. We were kind of burnt out with the traditional approach of mass campaigns and small sponsorships, et cetera, and we needed something new. We needed something to kickstart orthopedics and keep this momentum going on what we've built the last couple of years.